thank you all, and thank you all for coming on a sunny afternoon when you might be walking around the gardens, going to Wimbledon or elsewhere. I appreciate the fact that you've made the immense effort to be here. And I think what you've shown is what an eclectic and talented group of people you are. And in a way, your various places of origin are very much what the college is about, because I suppose the college is about the fact that we have burgeoning long-term disease in the world, whether it's heart disease, whether it's cancer, whether it's depression, loneliness, stress. But the current medical model is not sorting it. In fact, things are getting worse from child obesity onwards at a time when more and more is going to the health service. We have this other dilemma, which is the health service hasn't actually got enough money, or people, or doctors, or nurses, to keep up. So the direction we're going at the moment is a one-way street. And that's really why the college exists. It exists to support conventional medicine, but also to take it beyond medical procedures and drugs, to help it out of its box, to recognise that there is more to medicine than conventional medicine, and that people, communities are assets in their own health healing, to help them to be so. And that's really what you've described today, whether you describe yourself as a patient, or as a therapist, or as someone in the NHS. These are the stables we come from. And the crucial thing about the college is the people. It is about people. And of course, medicine's about people. We forget it. We think it's about filling in the boxes, or the computer forms, or the descriptions. It's about people. It's about relationships. And that is a crucial part of the way we work in the college, try to set an example, but also the way we feel that healing and health happens. And the other thing about the college, and again you described this today, is about connections. It's about us all connecting up, because we can't, any of us, do it on our own, whether we're a doctor, a nurse, a conventional medic, or whatever. Anything that's effective has to be part of a social movement, a collective movement, of people with similar values, similar determination, similar frustrations, and as Al sort of expressed, similar aggravating facilities to make people sit up and say, look, actually, we really do need to change. And I think many of you in this room do represent that sort of edgy pressure to make things different. And that mission in the college, I think, is expressed by the sort of work you're going to hear about, which we've been doing. The college, since we last met a year ago, has almost doubled in size to 2,000 members. We've had 70,000 different mail-outs. I think on National Social Prescribing Day there were 17 million Twitters. And we're gaining credibility and size which I think begins to get heard. And you know that you're getting to a certain stage of development when lots of people come along and particularly want to be involved with the college. And sometimes for their own reasons rather than the reasons of the college, but then again that says you've come to a stage of credibility where people want that association. I have to say that doesn't go for anyone in this room, thank goodness, but we do find sometimes that our reputation is being traded on by people who perhaps have their own interests, not that of the college. What is the college actually doing? I think our USP, I can describe it in terms of what we've done. First of all, social prescription. The college created, with Westminster University, social prescription as a national movement 3 years ago. I probably don't need to tell you, but today it is now national policy, and only on July the 1st it became general to every group of GP practices and every patient. So, in a sense, we're coming home as a college in the sense of social prescription now being part of NHS policy in England, spreading to the other 4 countries and worldwide. We've had 2 national conferences with the Prince of Wales the year before last, with the Secretary of State last year, and this year, in fact next week, we have a 2-day international conference with 15 different countries coming, and a great pressure on us, that's the college and the University of Westminster, to create an international movement for social prescription. In fact, only an hour ago I had to do a video conference for Iran because Iran wants to take it on, but they didn't feel they were able economically, for reasons you can imagine, to get to our conference next week. So we're sort of creating a world movement, which is very exciting, I think. And food, again, I think we've won our spurs. We've had two conferences, Food the Forgotten Medicine, which I think shaped the medical community a bit, because food certainly wasn't part of my training, nor was it part of what doctors and nurses tended to do. Our second conference, Food the Future Medicine, was an upbeat note to say it is coming. And this year, in October 24th, book your tickets now before they get completely booked up, is Food on Prescription. We are now moving into the mainstream. Amit, here in the front row, as a GP in Crawley, will be rehearsing what that 10-minute consultation in future will be with your GP discussing nutrition. We'll be looking at the connection between the human and the soul biome, which I think is the next stage of looking at nutrition generally. And we'll also be answering that question of why is it that those that most need good food are those that are least able to either afford and least motivated to actually get it. So some fairly edgy questions that the college needs to be moving in on. With Simon's help, we've taken on plants and herbs, and I think that's become another USP of the college. And complementary medicine, which people used to say, well, that was the college, we are doing a bit more of now, and unapologetically, because we feel that complementary medicine is part of what patients should be able to access as a choice with good information, when it's appropriate, when it's safe, when it's not taking a disproportionate amount of finance for what's being offered, and when we're not depriving people of other interventions that might be helpful. But given all those preconditions, the College of Medicine feels that this is now the time to look at this seriously. And next week we'll be having our third meeting of what we're now calling the Integrated Medical Alliance, which brings together the chiefs of all the complementary therapies, and to form an organisation that can become a spokesman for complementary medicine, but also one that can inform the public and the commissioners and the clinicians of where complementary medicine has a place and how to make sure your practitioner is of sufficient standard, and which sort of pushes the boundary in terms of public knowledge, public safety, and the efficacy of the treatment. So that's our next stage, and these two in the front row, great young leaders, are leading our integrated conference in the autumn, and I think we'll be talking about that later. Good. And I have to say, these two represent the new face of the college. You know, some of us have grey hair and have been at it for 30 years and have the arrows in our backs to witness it. But we have a new generation coming, and I can tell you, doctors and nurses and other clinicians and patients who are thinking differently. They don't want to be in the sort of trench warfare we've seen unproductively in this country over the last 10 or 20 years. They want to have a system that's far more outlooking, that actually helps patients to integrate their care rather than forbids them to do it and says you've got to choose complementary or you've got to choose conventional. So I feel that we are on the cusp of real change in terms of open-mindedness and a youth that realises that the current system has got to change. Over the year we've had our courses, our 2 foundation courses, now fully booked. Elizabeth is going to tell you about our diploma course, where we'll be producing our first graduates this year and our first fully fledged fellows. And the other thing I can announce to you now is we've applied for royal patronage, because we believe that we've now come to a state of credibility with membership, with message, and also with financial security, where we feel that we can go just a little bit more mainstream. Not too mainstream, we don't want to become the new orthodoxy, but we'll put our toe in the water of going that bit further. And then finally, in this rather long-winded report from your chair, I want to give some thanks. To thank first of all, the trustees, and Sarah represents the trustees here today, and we're giving her report shortly. To thank the council. At the beginning of every council meeting, I say to every member, what have you done for the college? It took an hour today before we got to the second agenda on the item. That's the sort of input and courage and motivation that we are seeing, and I hope all of you in this room will feel yourself part of the college and let us know what you can do for the future. I want to thank our scientific advisory group. They are not only the thinkers and the innovators, but they're sort of the ballast of the college. By having 20 professors, of which Sorrel is one, sitting as our ballast, we've managed in many ways to avoid people saying we're flimsy, we're unprofessional, we're unevidence-based, and all the other things that people like to throw at anyone who ever challenges the current orthodoxy. So the other thing is I'd like to thank Joe Tweedy, who is our brilliant editor of the various editorials you see on the website. Our own Amanda, who is amazing, Amanda is the college. I mean, this woman holds it, just like Pilar, holds it on her hands, and also to two others, AJ Yates over here, who is the very trusted deputy, and AJ, where's AJ? And the other AJ. AJ is AJY, AJ is AJ, but AJ looks after our money and finances, and I have to say, very well respected by the Charities Commission in terms of providing stuff which I don't begin to understand. And thanks Doug at the back for all his work on food. So, this is an enormous cooperative effort. I have one rather sad thing to end up with, which is to report the sad passing away of Richard Eaton, who many of you may have known. Richard was bigger than life. He wrote our complimentary newsletter. He was a barrister, and when he came and approached me and we hatched up this plan of him doing the complimentary newsletter, I said to Richard, I get lots of letters almost every week from people complaining about the college having anything to do with complementary medicine, and I get quite a few solicitors threatening letters from time to time. Could you, as you take over the editorship of the complimentary newsletter, make it clear that you're a barrister? Which he did. We haven't had one solicitor's letter, in fact, I haven't had one letter complaint in the 3 years that Richard did it. He was bigger than life. He came up to me at a reception 3 or 4 months ago and said quite casually to me, I've stopped my chemotherapy. And I said, that's great, Richard, and walked on. And suddenly I realised that this very self-effacing man was saying he'd come to the end of the road, but he didn't want to lay it on thick. And he was a truly great man. Some people are so understated, and he was one of them. And I have to say that he is the one that put me up to, and Amanda up to, bringing the complementary heads together. In fact, he announced in the newsletter that this would be a good idea, and Amanda and I just had to follow his words. So the success of the Integrated Medical Alliance will, I think, be total tribute to Richard, should it happen when we meet next week. He's very missed, and I think he's almost irreplaceable. Such a brave man too. As he died, Amanda was in constant correspondence. It's probably no secret the Prince sent him a letter, and then in his very last moments in bed, his wife and he were walking down a beach that they knew very well, and he just passed away. And such a noble passing of such a noble man, and I can't tell you how much I'm going to miss him on a personal level, as well as for all he did for the college. So on that note, I end my report, and thank you for coming, because, as I say, the college is the people, it's you.